All right, welcome. The last step number 6, the real facts. This is where we get into some of the scientific evidence in support of the TPLO procedure for ACL tears in dogs. There is an abundance of literature on this subject. We're going to continue to improve this content, keep you up to date with changes in the literature. But one thing to note is as you approach looking at scientific evidence, this can be really challenging. Statistics can say just about anything you want them to say. You can quote certain sentences from an article and leave out other sentences. We're trying to convey with the information we give you the overall reports that are consistent throughout multiple scientific publications, and we're certainly happy to answer any questions you have about other pieces of evidence that you've heard or things that might contradict what we say. But let's get through some of these. They're pretty good. These are the highlights. Here we go. Randomized, controlled, clinical trial comparing 2 techniques for cranial cruciate ligament repair. Okay, that's what you like to see. Randomized, controlled, clinical trial, comparing 2 techniques. That's good. That's good technique when it comes to creating scientific evidence. There are 80 dogs in this study. Only one of their legs had a CCL or ACL injury. They were negative for other orthopedic conditions, and these veterinarians were using sensors in the ground to determine how well or poorly a dog was using an operated leg. So that's key. They're not just people looking at a dog walking and saying, that looks pretty good, or no, I don't like the way that looks. This is true ground plate sensors that sense the vertical force that comes through a leg when the dog takes a step. And you can see peak vertical force was 5 to 11% higher in the TPLO group than it was in the lateral fibellar suture group at 12 months, okay? The lateral fibellar suture is an alternative surgery. We like to reserve that surgery for dogs less than 30 pounds, but certainly in this study was not as successful as the TPLO at the 12-month time period. That is consistent with what we see in our patients, especially dogs over 30 pounds. The bigger they get, the more easy it is for them to overpower a lateral fibellar suture, and the TPLO is rooted in changing the structure of the bone, and so they can overpower a fake suture or a fake ligament. They can't overpower their own bones. All right, so owner satisfaction, 9 or above in 93% of the TPLO cases and only 75% in the lateral fibellar suture cases at 12 months post-operative. That discrepancy was much greater at 6 months. At 6 months, only 35% of the lateral fibellar suture owners were satisfied with their choice of a lateral fibellar suture, or another word for that is extracapsular repair. Another word for that is the fishing line surgery. You might have heard fishing line. So this is a great study. We'll hope to give you more information on some of those terms later. Okay. Radiographic outcome and complications with the tibial-plateau-leveling osteotomy stabilized with a contoured locking bone plate. That is critical. The date of this publication is 2013. Anything on TPLO complications prior to this may not be using the locking bone plate. The locking bone plate has significantly reduced the complications as compared to previously reported surgical techniques for a TPLO, okay? And we use all locking bone plates on every case. All right, there were 3 minor postoperative complications in this study, looking at 56 dogs, and no major postoperative complications. Here's the actual abstract from that study. so that you can read it for yourself and kind of see all of the information here. And one of the things we talked about were the minor post-operative complications at 5.4%. No major or catastrophic post-operative complications occurred. One fact that you might say I was leaving out was that there were 4 intraoperative complications, including 2 cases of intra-articular screw placement. Okay, this is something that is a possibility. We're very thankful for the fact that we do not experience that in our cases on any regular basis. We continually avoid accidental placement of a screw within the joint. It's not that big a deal if it happens. You just remove it and replace it with a shorter screw. But there are ways to avoid that, and we take that into consideration on every case. That's why I didn't mention it, is because it's not necessarily a significance long-term to your pet. Okay, long-term functional outcome of the tibial plateau leveling osteotomy versus the extracapsular repair. Remember, another term for that is lateral fibellar suture in a big population of dogs, okay? So heterogeneous just means different types of dogs, different sizes and shapes. 2013 publication, TPLO resulted in faster limb loading than the lateral sutures, so they started using the legs sooner. I feel, it is my experience, that the TPLO is less painful than the lateral suture. You might say, less painful, you're cutting the bone. Well, the bone is, the innervation to the bone is much more geared towards sensing bending of the bone and stretching of the bone, rather than a nice, clean, sharp, surgical, purposed cut of the bone and then immediate stabilization with a locking bone plate. So in our experience, TPLO patients are less painful than lateral suture patients. The TPLO resulted in limb function indistinguishable from the control population at 1 year post-operative. Okay, this is not a sentence that is used in every surgical publication, and there's actually some publications that are good that say only about 10 to 11% of these dogs will regain normal use of the leg. You might read a quote on a website that says only 10% of dogs that have a TPLO return to normal use. Well, remember, all of these dogs have arthritis, and that arthritis progresses in all of these patients. And so expecting complete normal return of function in every dog is unrealistic. We're looking for what produces the best return of function. And here is that abstract. If you'd like to read that, you can pause this and read it. Here is a systematic review of surgical treatments for cranial cruciate ligament disease in dogs. This is a great study, 2014. The strength of the evaluated evidence most strongly supported the ability of the TPLO to return function to dogs. Okay, so this is huge because it's looking at multiple studies. Functional recovery in the intermediate postoperative time period was superior following TPLO compared with the lateral suture. So that supports what we've been saying. We hope to provide you with more and more information as we progress. And thank you so much for hanging in there with us through 6 amazing steps. If there are any questions, feel free to contact us at this information. Thank you so much. Bye-bye.